We're here with Dr. Christine Mitchell. Our talk today is all about osteopathy. So, our speaker is Christine Mitchell. Dr. Mitchell has practiced general osteopathic medicine since 2006 and has lectured and trained students in osteopathic courses and workshops all over the world. She's a faculty member of the Biodynamics program, which is dedicated to education in traditional osteopathic studies. She has provided clinical services for the Osteopathic Children's Clinic of Portland, Maine, is a faculty member of the Bavarian Pediatric School and Clinic for Traditional Osteopathy, and provides general osteopathic services for all ages. She's currently practicing in Katonah, I hope I pronounced that correctly,
Yes.
New York. And our talk today is also an offering of the Pranada Wellness Center. Christine serves at our annual wellness retreat for the Pranada Wellness Center. Pranada Wellness is currently offering talks like this about wellness and holistic healing practices, and offering a week-long healing immersion at the Temple of Compassion in Burton, Texas. Our next healing retreat is going to be March 15th through the 20th of 2025, and we'll post a link if you're interested in learning more about that. These retreats combine osteopathic medicine with gifted healers and physicians like Christine with Ayurvedic medicine. So it's a really beautiful immersive healing event. You can learn more by following that link. I think we might have a few openings left for the next retreat. So I'll hand it over to Christine. Thank you so much for being here.
Oh, it's my pleasure. I love to get together and talk about and study osteopathy. It's really a privilege. And so I thought I would start with just some general information, because there are probably some of you out there listening that may have never heard of osteopathic medicine, or a DO, which is a doctor of osteopathic medicine, or osteopathy. So I'd like to just give a little brief summary of that before we get into our talk. And so osteopathy, or osteopathic medicine, is a philosophy, it's an art, and it's a science. And in the United States, there are two types of fully licensed physicians to practice medicine, a full scope of medicine. And if you go to an osteopathic medical school, you are granted a DO degree, or a Doctor of Osteopathic Medicine. The other licensed physician is obtained when you go to an allopathic medical school, and that there you are granted an MD degree, medical doctor. And there is a similarity between both types of licensed physicians, in that we have to have 4 years of undergraduate education, then we have to have 4 years of medical school, and we both have an internship and a residency in whatever we choose to specialize in. So that is where we are similar. But there are great differences between the practice of allopathic and osteopathic medicine. And first is the fact that as an osteopath, we are trained to use our hands to diagnose and treat disease. And in fact, traditional osteopathy is really foremost in the practice, is that we use our hands to diagnose and treat disease. And equal to that, where we differ, is our philosophy. So osteopathy is truly a health-based practice. In other words, we focus on the health of our patients to treat them. Whereas an allopathic philosophy is a philosophy based in disease. So allo meaning against, pathy, disease. So the strategy is to try to basically attack or remove disease. And so that just is a very basic fundamental difference between the two. Osteopathy was named by, it was actually given to Dr. Still, who's the founder, who we'll talk about shortly. But it was given to him, this idea that came to him, where osteo, coming from bone, osteon, and pathy, which means to suffer. So what he surmised is that we will begin with the bones to study and help the suffering of our patients. But that is where you begin, is with the bones, but it's much more inclusive than just bone. So when a patient comes to see us, when we are in our osteopathic philosophy, we are really looking to the wholeness of that patient. So we are looking towards health. So part of our exploration with the patient is the things in their life that make them healthy, that they feel good about, as well as looking at the traumas starting at conception or at birth. I mean, in that environment, the whole way to the present time. So we are really trying to get a complete picture of who this person is. And then we put our hands on and we listen with our hands. We can palpate and see how a patient is structured, whether shoulders are unleveled or legs are shorter or there are curves in the spine. But we can also listen to inside of the patient with our hands. And so that is paramount to an osteopathic exam. We're trained in many modalities that we call the branches of osteopathy. One of the primary modalities that I use is biodynamics and osteopathy in the cranial field, but also functional work and soft tissue, myofascial release, muscle energy, counter strain, balance ligamentous tension, balance membranous tension, balance fluid tension, lymphatics, visceral, HVLA, which is cracking. So we use and are trained in all of those modalities. And in fact, many body workers out there borrow some of osteopathic work to fill their practice. So that's what we are in a generality. So now I would really like to get to the lecture itself. So this talk is about what is osteopathy, and asking the question, what is osteopathy? And to answer it in a few sentences is basically impossible. It would be like asking a Kriya master, what is Kriya Yoga? And for them to be able to answer that would probably take a lifetime. So understanding of osteopathy is dynamic and it is a lifelong journey. And so what I'd like to do today is talk about the history and the founder and two profound pioneers of the profession. And I would like to give you the impression of osteopathy through its language. So that is how this talk is going to be organized. But if I had to give you a simple answer of what osteopathy is, I would say that osteopathy is love. And it is a love that is not individual. It is a love that moves and passes through everything, undiminished. And where that love comes from is a mystery, a greater consciousness, the unknown, the divine, God. So anything that manifests is an act of love. Life is love and is a precious gift. Osteopathy is a precious gift to humanity of love by God. Next slide. So the founder of this profession is Dr. Andrew Taylor Still. Osteopathy came to be in the mid to late 1800s. This is Dr. Still in his 80s climbing a tree. Next slide. So, oh my goodness. Dr. Still's life is one to study. He was ahead of his time in the way that he saw life in the world. He was a pioneer, and actually truly a pioneer. He was born in Virginia, and his family moved to the Midwest um, to basically work in and around the Shawnee Native tribe. His father was a physician. That's how Dr. Still became a physician. And his father was also a Methodist circuit rider, preacher. So he had some connections to John Wesley and the Methodist movement, but also the New Thought movement that was happening in the 1800s. But being a pioneer, you had to completely and fully understand the natural world. Because if you didn't understand the laws of nature, you wouldn't survive. So you had to know when the seasons were changing, well before the seasons began to change. These are things that you can sense and perceive if you are very awakened. You had to know about the winds. You had to know where you were from a point of direction. So Dr. Still studied man in the natural world under the laws of nature. He also experienced a tremendous amount of tragedy in his young adult life. He lost his children to meningitis and had physicians trying to help and who could do nothing, including himself. He was a hospital steward and a scout surgeon in the Civil War, one of the bloodiest battles of all history, with one of the greatest loss of lives. He lived through slavery and the tragedy of the African American people. He was an abolitionist. And he saw the genocide of the native peoples of the Americas that was astounding. When he lost his children, the story goes, is that he put a call out to his maker because he knew there had to be something different than what medicine had to offer to help the suffering of these people and of these times. And it really was almost downloaded to him from above about what to do. And he began intently studying man, anatomy, physiology in context of the natural world. And it came to him that through his hands, he could change physiology of his patients and help them to heal with complete recognition that it was the patient who did the healing. We were just to help and to facilitate what nature does on its own. When you think about, um, when I think about maybe being a pioneer at that time period and what it must have been like to move across the country, I mean, barely there were any roads, there were hardly any people, no towns, no lights, there was no electricity. And could you imagine? And you move slowly. You couldn't move fast because of the wilderness and the roads and of just really looking for what you don't know. That is the definition of pioneer, looking for what you don't know. And to experience that, under the night skies with no light pollution in the stars and that silence. I mean, it would change any one of us. So he was in the perfect environment to be able to listen to the divine. And he later lived among people whose whole purpose was their spiritual practice, the native people. They were in communion and communicating with the Waka, the mystery, at all times. They couldn't lose that connection. Dr. Still wrote from the Shawnee language, Illinois Tapamalakwa, which means the life and mind of a living God. Oh, next slide. So let's learn a little bit of Dr. Still through his words. So this is what he thought about bone. To know all of a bone in its entirety would close both ends of an eternity. Would close both ends of an eternity. That's how he saw bone in eternity. To find health should be the object of the doctor. Anyone can find disease. I love my patients because I see God in their faces and form. Human life is eternal. We have no proof otherwise. Life enters the forest of flesh as man. It carries constructing wisdom and ability. I am not ashamed to be a child in the mind of God. Life is that calm force sent forth by deity to vivify all nature. Next slide. So this is Dr. William Garner Sutherland, and he was a student of Dr. Still. He was also a pioneer in our profession. He himself, and he writes this, that the idea of this came from somewhere else. It wasn't him. That he recognized that the bones of the cranium actually had motion, a breathing motion, when all of the world thought the cranium was fused. And so he studied these ideas for 30 years before he talked about it to the profession. And he is the one who discovered what we call, or what he called, osteopathy in the cranial field. We call it cranial osteopathy, and also he has used craniosacral treatment. He didn't use therapy. So many of you may have heard of craniosacral. Well, it originates in the osteopathic tradition and teachings, and also a beautiful man. Next slide. So let's hear what Dr. Sutherland has to say. Next slide. All life is manifested in energy or motion. I'm going to have an aside here. So everything what we do in osteopathic medicine, in traditional osteopathic medicine, is to perceive motion or lack of. So this is a fundamental principle in what we do. Without motion, in some degree, there can be only death. Furthermore, motion is essential to function. But that motion must be intelligent and purposeful for the living organism to successfully compete with its environment. This is my favorite line. Hence, that motion must be guided and directed by a supreme being. There must be a channeling of the universal intelligence down to the individual cell or organism. Otherwise, all would be chaos. What is the supreme intelligence? How does the channeling take place? No one knows for sure. The fact remains that the existence of such is a positive and irrefutable fact, which is emphasized by the world's greatest scientists. Fingers capable of feeling, thinking, and sensing. And seeing, requiring brain cells in their tips, locating etiological factors beneath, as well as throughout all bodily tissues. The finger feel, the finger thought, and the finger sight are the only way to read the diagnostic message. Last quote. Osteopathy is governed by and through the intelligent application of the cultivated sense of touch. So you have to touch. Osteopathy cannot be learned by observation. Eyesight cannot observe the sense of touch. There must be a finger feel, a finger thought, and a finger sight in order to note how the lesion moves, when it moves, and the change occurring after. Next slide. And our last pioneer that we'll talk about is Dr. James Jellis. And Dr. Jellis was my teacher, and he was my friend. And he brought to the osteopathic profession the work of biodynamics. And biodynamics is based deeply in embryology. And he recognized that the motions and movements and indwelling forces that were perceived by Dr. Still and Dr. Sutherland were identical to what is described in embryology. Specifically, an embryologist named Dr. Eric Blechschmidt, who studied thousands and thousands of slides of embryos to actually see how the unfolding of the precious life was happening, used terminology and words and directions and shapes of exactly what Dr. Sutherland was talking about. And then Dr. Jellis studied deeply what these motions, shapes of change, forces were doing throughout his, I think he said, over 200,000 treatments, at one point, even more. And he began to teach this to the profession. And it is now one of the greatest gifts that we have for our patients. So let's hear what Dr. Jellis has to say. We are designed to heal each other. The cause of an illness is not the illness itself, but how one became susceptible. The health creates the lesion to protect the whole in an act of wisdom. When we hate lesions in ourselves, we miss the real story of love. Does hating a lesion help healing? Self-pity is a poison. Feeling healthy or ill is the same fulcrum. Neutrality can improve both levels of function. How often do you consult with your patients on this? Some of these redwoods feel as if they never began. Osteopathy is an opportunity to serve the suffering persons in this world through the very humbling experience of coming to know the magnitude of the heavens, as Dr. Still described. As one grows in this work, everything will slowly change until the truth awakens the desire to serve without any reward. Our tradition is a living organism that begins with sincere respect for all aspects of our profession. This is what can and will bind us in a healthy expression of community. Traditional osteopathy is an oral tradition that functions through mutual love between the elders and the beginners and embraces the inner discipline and fortitude to practice what we preach. Okay, next slide. So what is osteopathy? Osteopathy is the art of using one's hands to engage a therapeutic process governed by natural law, the natural laws of life and health of a patient. Next slide. So osteopaths communicate and cooperate with laws not framed by human hands that are supernatural in cause. Our philosophy and practices utilizes and trusts the inherent wisdom and intelligence behind self-healing, self-regulating processes with any living organism. Next slide. So, what are natural laws? Well, next to God, our ultimate teacher is nature. And it is from the natural world that we experience the manifestation of the divine. And we are a manifestation of the divine. So the laws of nature are principles which govern natural phenomena in the world. So the natural world obeys the laws of nature. For example, our biology, your biology, my biology, is present without any influence from man. We obey natural laws. My hand is going to become a hand, and a chicken is going to become a chicken. And a wise, all-knowing, restorative force with intelligence is in every cell of our body, keeping it well. These are natural laws. Next slide. Wholeness. So instead of focusing on fragmented parts, we listen to wholeness in our patients, and we listen with the depths of our souls without imposing any sense of what is right or our idea of what it should be. We just simply sit and listen with our hands on our patients to what is the wholeness for each individual, and recognize that wholeness is in context to the wholeness of everything. Next slide. So, as I said, we're going to talk about the language, and we're steeped in the language of osteopathy. So, health. How do we see health as osteopaths? Well, we recognize that a higher mind is indwelling in our health, and that health literally is perfection. At the moment of conception, the health in a form of a matrix is imprinted on the protoplasm of that ovum, of that fertilized ovum. We call that the blueprint of life, the embryonic matrix, the matrix of the health. And it is that health for which everything must be in relationship to, even when there is disease, or we could not be alive. In other words, life is perfection. If there isn't perfection in something alive, it cannot live. It wouldn't be, we would not be alive. And so that's how we see health. And our perfection persists throughout life, from that conception to the moment that we pass. Next slide. Okay, so of course there's the outer physical, which most of us are focused on, and we do include it in osteopathy. I mean, we can look at a patient and say if they're sick or not sick. We can look and listen to their body, their hearts, their lungs, palpate organs. We can look at structure and see a shoulder that may be unleveled, or a hip that's unleveled, or scoliosis in the spine. We can check gross motion, like how the hands move, or how a joint moves, or how a shoulder moves. And we call that the outer physical. Next slide. But it is the inner physical, or let's say the inner world, where we have most interest. And I have on the slide inner physical, but it is, I would say, more an inner world. an invisible world. But let's talk about the physical. So next slide. So our physiology would be considered the inner physical. So the normal functions of a living organism. That's the definition of physiology. And what are some of these functions? So metabolism, you probably have heard of that word. This happens in the inner world. It's happening at the level of protoplasm, at the cellular level, at the tissue level, at the organ level. So these are the happenings or the going-ons in life that keep us alive. So, and these forces are interesting because there are forces that we call anabolic, which actually build or create things, and there are forces that are catabolic, which destroy, where there's death of cells. And then you must have death of cells in order to be able to be created. And this is happening every moment. And then we also have sustaining forces or processes. So we kind of wrap that into the word metabolism. We also have breathing. Now, breathing can be seen in the outer world, but also absolutely in the inner physical. Breathing causing oxygenation and redox reactions in the body for energy. Circulation. We have the blood to and from the heart. We have bioelectric, biomagnetic movements of electrical current. And that current doesn't just run on nerves, the current runs on tissues, the fascias and bone. And of course, we have excretion, which again, we can see in the outer physical, but certainly see excretion happening in the inner world. Next slide. And then we have the subtle physical body. So what is the subtle physical body? Well, this probably is in the realm of the invisible, but it is something that you can perceive with your hands, that we can actually sense this. And it is a body of light. Next slide. It is also a fluid body. And the fluid body is fundamental when we practice osteopathy, especially in biodynamics and cranial osteopathy. So this is something that is actually pretty easily perceived with our hands. But this is through which we diagnose, is through this fluid body of the inner world. So fluid in the context of the fluid body does not just mean like a water liquidy substance. The fluid body is really at the level of the protoplasm. So we talked a little bit earlier that at conception, the only thing that is present is a protoplasmic blob in a 0.1 millimeter large cell. And it is through that protoplasmic blob and these forces that are biodynamic, meaning coming from outside, that it's not caused by the genes, but these forces that are creating shape and form actually emerging from a protoplasmic blob. So that is the fluid body at the beginning, but that function of that protoplasmic movement carries with us through all of our life, and we feel this breathing in it, almost an amoeba-like feeling when the breath through the fluid body occurs. So it moves as one unit of function. In other words, it's like a single drop, and we can feel that fluid body from the feet, from the head, from the side. And again, we use it to diagnose the patient and their indwelling functions. And the other fluids of the body are part of the fluid body. In other words, the blood and the lymph, the body tissue or the body fluids are part of the fluid body, but they are not the fluid body. In other words, it is its own, I'm going to say entity, but we all have this, and we're actually functioning in it from the very beginning. It's the next slide. So all of the things we just talked about, from the outer and inner physical and the subtle and fluid bodies. So all of these inner processes culminate into some pattern of motion and movement. And this motion and movement, these indwelling therapeutic forces, create shape and form. And that is actually what we feel and sense when our hands are on patients. We actually feel breathing shapes of change within the patient that reflect the anatomy and physiology. And because we feel shapes and there's more space than the actual anatomy, we call these fields. So it's like a field of motion that's representing the knee. So these are metabolic fields from which the anatomy is emerging, or the shape and form is emerging, or we also call them fluid fields. Next slide. So all of this motion, or all of this movement, we say is kaleidoscopic, and it really is. So I'm going to say some things that may be a little bit shocking, but it is very true. So the kaleidoscopic movement, we do not have the sensory apparatus to be able to see it. But if you could imagine, if I could put Rosa in front of a screen, and I could see Rosa from the inside to the outside all at once. So I could see the quarks of Rosa's system and the electrons in the atoms all coming together to create compounds, elements and compounds forming and joining to create cells, and the cells becoming tissues and organs and coming out until I can see Rosa there. All happening in a moment. And then it all goes, and then it all shifts and changes every moment. Every moment, things are changing through those forces. So cells are dying, cells are becoming, there's so much activity from the deepest level to the gross level. And what we feel are these shapes of changes, and they're very diagnostic. So in one sense, we are dying and becoming every moment. We are certainly different every moment. You never can go back. In other words, every moment is a new you. So in a sense, we are appearing and disappearing in front of each other from moment to moment. Next slide. So we keep talking about these indwelling therapeutic forces. And that's what we say osteopathy is, that we are communicating and cooperating and using these indwelling therapeutic forces. Next slide. And we believe these forces are the forces of embryology that begin when we are conceived to create all of us, and not just the physical, but the emotional, the psychological, and the spiritual. So, and again, these forces are with us from the moment of conception to the moment that we pass. They are causing, or behind, should I say, our growth and development, as well as our healing. So it's these forces that are healing us. And every one of us is in a state of growth and development. It doesn't matter if you're 1 year old or 99 years of age. We are still in a moment-to-moment state of growth and development. And we all are reaching milestones during our time here on Earth. Next slide. So another big part of our language is a neutral So neutrality is key, both for the practitioner and for the patient. And part of our job is to help a patient establish a very solid neutral in themselves to go about life and also to receive a treatment. So the Kriya Yoga practice is certainly a way to become more neutral to life and life's events. And the deeper the neutral, the deeper your neutrality, the deeper the therapeutic processes, and the deeper the treatment can be. Next slide. And of course, in our language is breathing or respiration. And we talk about 3 forms of breathing in our studies. And one obviously is thoracic respiration, and how incredibly important it is for our thoracic respiration to be functioning optimally. And there's lots of ways for restrictions to happen with our breathing, from the emotional, psychological, and even spiritual and physical ways. So breath is key. But also we talk about primary respiration, which is the breathing of that fluid body. And it is a much more subtle type of breathing. It's on a different rate, and sometimes it doesn't have a rate, but it can be diagnostic in the rate of that particular person's fluid body. And then the third breath that we talk about in our work is the breath of life. And that breath is passing through everything undiminished. It is also love. It is behind manifestation of everything. It does not have a rate, but it does have a tempo. And it also primarily is a creative force, but it does have the sustaining and destructive forces with it. It depends on what we are being called to observe, or what it's presenting to us, how it's presenting to us. So next slide. So the next 3 slides are about the fluid body. So the fluid body has basically levels of tissue, fluid, and potency. So tissues are what we can see. You can see the skin on my face, and the hair on my head. But you can also sense this in the fluid body, and it's kind of remarkable, but it's true. And we recognize that any tissue whatsoever, muscle, bone, even cell, because it has a membrane, any tissue before it emerged into form was actually fluid. And when we are working with our hands on a patient, when, say, I'm on a femur that had trauma, when that expression and the sensory experience of that femur feels like it has turned to fluid, we know that good things have happened. So the density goes away, and how we perceive it in the inner world is fluid. And in fact, bones are quite fluid. They are comprised of 20% fluid, but they're very fluid in nature. Anyway, next slide. So the fluids themselves. So obviously, fluid exchange is vital to normal physiology, and all processes of life occur because the fluids flow. And fluids flow through channels like arteries and veins, but across membranes and also into open spaces. the fluids of the body and the fluids of the fluid body. And if the fluids stagnate, in other words, they are not moving profusely, this is when we see that life becomes diminished and that our health is compromised. Next slide. So then also part of the fluid body is potency. So potency is the bioelectric, biomagnetic movement and fields of the fluid body. And again, these currents do not just run in nerve tissue. The currents run through all of the fluid body and also run along bone and in fascia. We are a piezoelectric system. And this potency can lesion, and we see this often in a state of shock. So the nervous system and the current gets bound up into certain regions of the body. And part of our work as osteopaths is allow a release of that binding. So all of the movement of the potency is fluid and again, not really being sensed. In other words, when things are healthy, we're not sensing potency, we're just sensing wholeness. But when it laminates out and we can palpate or experience this, we know that something has happened to that system or that organism. And almost always it's a type of shock. And that shock can be emotional, psychological, physical, spiritual. Okay, next slide. We're getting there, we're almost there. So I put this slide, organs and organ systems, because I want to tell you that organ systems do not exist. And yet we have divided organ systems and we have specialists in organ systems, and that's a gift, really. But in the true sense, they don't exist because all of it formed together. So no organ system is in isolation, and everything is functioning as a unit. Now, sometimes we get into trouble because, we can have an organ system treated, whether through medication or, a procedure or surgery, and then we see lots of side effects in the other systems of the body, if you will. So it's really important to keep a very broad mind when we are focused on one system, like the GI tract or, the nervous system. But again, that doesn't diminish, the specialization because that level of knowledge is very appropriate to be a neurologist or a gastroenterologist or immunologist. I mean, that information is really important, but we need to come back to the wholeness of it as well. The other thing is we do treat organs, but when we treat osteopathically, we see the organ as part of the whole. So if you have a congested liver, I'm not going to go after and do a liver pump. We have to listen to the wholeness of that patient and again, allow the health that exists in that patient to bring that part that does not have health, that is diseased, back as best as it can back into wholeness. And then we support health through the things that we do, the foods that we eat. We honor our temple, the ability to become neutral, to calm our minds, service, giving to others. I mean, these are the ways that we can help to build our own health. Next slide. And I put this slide in to really talk about the autonomic nervous system. Our nervous system is made of many parts. We have the central nervous system, the peripheral nervous system, and we have this branch that we call the autonomic nervous system. And I think it should be called the automatic nervous system because it is what controls everything that's automatic in the body. It controls our breathing, our heart rate, sweating, peeing, pooping. I mean, just anything that we don't have to think about fever, just all of the regulation inside the body is done through the autonomics. But the autonomics are not isolated whatsoever, as we just talked about with systems. In particular, they are really part of what we call the neuroendocrine immune axis. So the autonomics are deeply embedded with the endocrine system. So all the hormones of our body, not just female hormones or male hormones, and also very much imbued and intertwined with the immune system. So the neuroendocrine immune axis is really one big function. So if any of those aspects of a person are unbalanced, all of this is unbalanced. And as osteopaths, we work through the autonomic nervous system, again, in context of wholeness, to help bring balance at these very deep levels. Next slide. Okay, another part of our language is the word soma. And soma is actually a very, very old ancient word, and it is a Sanskrit word, and it means perfect form. And in Greek, soma is used in context of the physical body, perfect physical, in with mind and spirit. So mind, body, spirit, they use the word soma for the physical body. In osteopathy, we believe that the soma is truly the perfect physical body. And again, recognize that a perfect physical body is fluid. The experience of it is fluid. Next slide. And then when we actually name a problem with the body, we call it a somatic dysfunction. And there's a lot of us that don't like that because we don't believe that the soma can be dysfunctional. We just said that the soma is perfect, but this is what the team came up with and called it somatic dysfunction. Those of us who hung out with Dr. Jealous, we like to call it the old term, which is an osteopathic lesion field, or osteopathic lesion. And the reason that we like this terminology is because there is no lesion in isolation. And to try to exemplify this, we can take a issue like carpal tunnel. And most physicians will say, oh, the reason you're having symptoms of numbness in these 3 digits and maybe half of the fourth and weakness of the thumb is because there is compression in the carpal tunnel in the wrist. But anyone, as an osteopath who has treated carpal tunnel syndrome, when you put your hands on that extremity, you see actually the entire extremity, almost always the neck, almost always the shoulder complex, going the whole way down, and many times completely related to the diaphragm itself. And so we see carpal tunnel as possibly a breathing problem and not necessarily a repetitive use problem, though it can be repetitive use. So what I'm saying is when you put your hands on and you see dysfunction, it is in the shape. It actually has a shape, and where you don't feel the breathing and you don't feel the flow of fluids or you don't feel the potency moving. So this is how we are diagnosing that inner world. And it is through the inner world that we can heal. Okay, next slide. So finally, healing, which is why you come to see an osteopath. And I want to begin with saying that we as osteopaths never claim to be healers. We do not believe we are healers. We completely trust in the self-healing, self-regulating systems of our patients in connection with a supreme intelligence, deity of divinity, God, as doing the healing. And for whatever reason, God designed us to touch each other as helping that process happen. So healing takes the time and tempo that it needs to take. So we have to be patient, and we have to be willing to do our part and completely trusting that things will be as they are going to be. So the natural world expresses itself in distinct and ordered manner, and our inherent healing, self-healing, self-regulating follows the same order of the natural world. And again, takes the time and tempo that it needs to take. And on rare occasions, we see the miracle. Patient lays down and you treat one time and they wake up and that thing is done. But most of the time, it takes time. All right. And the final slide, next slide. So I want to read this, and I think this will make more sense after this lecture to understand what Dr. Jealous was saying. So I am reading this to honor my teacher, Dr. Jealous. Osteopathy is service. We use our hands to treat the whole patient, to listen to the indwelling movements of life, to treat all levels of illness, to assist in building the patient's functional reserve, to support homeostasis and trophicity by balancing the activity of the autonomic nervous system, to explore laws not framed by human hands, to cooperate and communicate with laws of nature, to find the health, to get to the treatment plan, to get to the diagnosis, to help establish a point of rest or neutral around which the whole can come to balance, to find cause. We believe we have innate capacity to heal. The patient functions as a whole. The autonomic nervous system plays a major role in disease and healing. Structure and function are one form of activity. The divine is indwelling. Life moves beyond death. There is a constant movement towards normal. We are here to serve humanity. Normal is a sense of peace and harmony, ease of motion without tension, a capacity for neutral, a sense of wholeness to life, the capacity for adaptation, change without compensation. And Dr. Still has told us, skill is proportionate to one's understanding of normal. Next slide. So, in gratitude and in service.
Wow, thank you so much, Christine. And yeah, this has been such an enlightening talk for me. And anyone who has questions, there is a question already in the chat box, so thank you for putting your question there. Anyone else on the call who has questions for Christine, you can put them in the chat. If for some reason you're not able to do that, you can also raise your virtual hand and we'll try to find a way to unmute you, but the chat is preferred. Do you have a few minutes for questions, Christine?
Oh, yeah, of course, yes.
Cool. So our first question is about your opinion on osteopathy and vaccines.
Oh, well. So we love to treat people after they've been vaccinated because we absolutely see a response. And many times, we talked about potency. And vaccines can create a kind of a stagnant potency or a building up, and many times close to the center of the brain. So we absolutely encourage patients to get some kind of treatment after there's been vaccinations, and especially the children.
Thank you so much for this talk. I've studied for also many years with many of the same people, seen so many osteopaths talk about this subject, and nobody that I recall has ever just so succinctly said that osteopathy is love. I've heard so many other osteopathy is service, osteopathy is all these beautiful things that you've talked about, but I can't think of a better way to say it. So thank you so much.
Yeah.
If any of you don't already know, Bonnie is also a very gifted osteopathic physician and is also a part of the Pranada Wellness team and will be serving at the March retreat as well. Um, we do have another hand raised to ask a question. And
Sure. I just want to before I answer, I have 6 chat, but I can't open the chat for whatever reason, the chat
okay.
preview. So if someone else can do that, and then I'll answer the question. Who is it from?
Hi,
Okay.
can you hear me?
Yes,
Yes.
I can hear you. Yes.
Yeah, Dr. Mitchell, thank you for your talk.
Sure.
It's very enlightening. I thought I'd have to wait till my next life to get enlightened.
Right.
But anyhow, I heard your question about the vaccines and the self-healing body can heal itself. And I know you sort of answered it, but my question still remains is, COVID vaccine and all these things we do for our own precautions or also not to spread the thing. But but I wonder if it interferes with the self-healing of the body when you take these vaccines.
Um, yes, I mean, I think any a little bit of we'll call it a little bit of a shock to the system can certainly slow things down, and has the potential to interfere with self-healing. And yet, when we step out and look at the big picture, we're trying to do what is best for the goodness of the greater good, should we say. And whether the COVID pandemic came on so acutely, and I think there were so many questions that were unanswered, and it was the movement of the collective to use vaccinations. In hindsight, we may find things that maybe it wasn't the best direction to go. It's still out there. We don't know completely, and maybe we never will know. But it is something to think about. If, by using vaccinations, without a doubt, they work against the bacteria or viruses that they're intended to work against. But what about the bigger picture? And does it weaken the immune system? And these are things that are not necessarily looked at in any great degree. And why it is challenging is because I don't know that we have the technology to look at that level of the potential of multiple vaccines in a system. And hopefully, by the grace of God, that technology will come along, or we do better long-term observational studies. But we don't know. And when it comes to the collective or community health, the powers to be believe it's better to vaccinate and not have things like polio run through, or even the streptococcal diseases. So that is the decision. But what does it mean when we have so many, and especially in young children? We definitely see side effects from vaccinations, and we definitely have many more people on the planet than we ever have 8 billion people. It's a lot of people. So it would be nice if we start to study this in a much broader, holistic way. But sometimes, in an acute situation, you do the best that you can. And sometimes to save a life, you do something that wouldn't necessarily be the best in the wholeness of that person, but to save their life, that's what you have to do. Does that help?
Yes, it's okay. Thank you for the answer. I just wanted to make sure, because I believe in self-healing. I don't like to just take antibiotics and,
Sure. It's
at the
better that,
at a,
yeah,
at a slightest thing, vaccines. And sometimes I feel maybe I'm wrong, but the pharmaceutical companies' profit margins are more important than my health.
yeah,
So it's just that maybe I'm skeptic in that way. That's all. And I thought, so I'm not sure. Like your answer is good. Like you said, there's still research or not enough technology. But meanwhile, it's confusing. It's to say the least, because I totally believe in a good diet and a good health and good healing, self healing. But people, doctors, like maybe the MDs, not the DOs, but they jump into these prescriptions of antibiotics immediately.
I agree. And I don't think it's a good direction to go. So that's an opinion, but I think our best bet is one to listen to our connection to whatever is greater and guiding us. I think we do our best to take as best care of ourselves as we can. I think your questions are very valid in the world that we live in. Um, and uh, and some of our questions are never quite answered. But if we wait and listen on a personal level, we can get some of those answers to help guide us in our decisions of what we're going to do. I think, you know, your questions don't really, they're not going to get a straight, black and white answer. I think it's an
Yeah,
answer in motion, if that makes sense.
yeah,
But
it does make sense. I appreciate your time and sharing. What you do and what you know. What you know. It's very very important to share this stuff. And so sometimes maybe there's a balance between the DOs and the MDs somewhere. There's a fine line somewhere that
yeah.
not one has the answer for everything.
No, well, that's the truth. That's a real true statement.
Thank, thank you so much, and
Sure.
all the best to you.
Thank you. You as well.
We have a few more minutes if anybody wants to put a question in the chat for Christine. Now's the time. I have a question if I can slip it in.
Sure, please.
Why does the body create a lesion in the first place? Like, what's the intelligence there behind that phenomenon?
Okay. So this greater intelligence beyond our capacity to see why is what actually, and we'll call it the health, by the way, that guiding principle of perfection. It has a consciousness, and it is what creates the lesion to actually hold a pattern that allows that life to continue as best as it can in a period of time. And so that's one of the other reasons we don't go after lesions. We have to listen to the wholeness because that may not be ready to let go. And then many times, if you see the lesion and you start trying to fix it in the wrong time and tempo, that system can crash and you can actually make things different. So it is this innate wisdom that we're talking about that we think are the natural laws of life that are creating these patterns and holding patterns until a patient is well enough for it to move. And it may always be with them for the rest of their life. In other words, it may never go away because that is what the intelligence is, that pattern is actually being held because of some divine wisdom. Does that help?
Extremely helpful. Thank you so much. One more question that came into the chat.
Okay.
asking if you would go deeper into breath and into those three types of breath you were talking about earlier.
Okay, well, when we look at embryology at the moment of conception, that's actually when all the three breaths come into that organism. Okay. And through growth and development of that embryo, and then through birth into, the human world, those breaths separate out a little bit. When we are young in our infancy, in the first years of life, the respiration of our fluid body that we call primary respiration is really the same as thoracic respiration. In other words, you can't really see the difference. Now, this is a hard concept to wrap your mind around. They are on different rates, but yet they come from the same fulcrum. And the breath of life, if you are alive, is always passing through you. So anything that manifests is being guided by the breath of life. In other words, it is continuous, and that is mysterious, but again, you can perceive aspects of that motion and movement. And so if we go to an adult now whose thoracic respiration in some way has been impeded from trauma, maybe smoking, a scoliosis, like bending the spine so the diaphragm can't drop easily, um, GI issues, pelvic issues. I mean, there's tons of reasons where thoracic respiration is impeded, or that you're out of shape, or you're really stressed and your respiration is really high. So you are not fully oxygenating and creating the metabolism that you need, this metabolic fire that comes through breathing that you need. And so we very much work in many ways, sometimes even in the gross mechanical way, to help that diaphragm and to help the breath come to its peace. We recognize its fulcrum, like where the fulcrum is in perfection and where that patient is breathing from. Thoracic respiration should be well below the diaphragm. In other words, where it begins. Like if you watch your breath and you see where the breath is coming from, like its fulcrum is what we call that. If it is above the diaphragm, then it's not in its healthy, it's not in a healthy form, or the fulcrum is not in the correct place, if you will. But if your breathing starts down in your pelvis, even a little bit outside your pelvis, like around the perineum, you know that your thoracic respiration is in a pretty good place, that the breathing is healthy. Primary respiration, there is always perfect breath again, but then we can see a little bit of distortion in the breathing of the fluid body as well. So there's the perfect, and then there's what we call the functional, like how is that breath functioning in the fluid body? So we tend to just synchronize with that motion, and then the self-correcting mechanisms, kind of step in and correct it, and without us sometimes even seeing it. In fact, most of the times we don't see it. That fluid body is breathing a little bit better through the primary respiration. And again, that is through all of the tissues of the body. It's brain, it's, the thigh, hamstring muscles, whatever, that breathing we feel through primary respiration through all of the body. Did that answer your question, or do you have something more you'd like to ask?
I'll let them type into the chat their response to that. But I think that's a beautiful answer. I'm sure they're very satisfied. And there's just one more question. Yes, yeah, she said that did answer the question. Do you have any recommended reading on osteopathy for a beginner? Somebody like a massage therapist. And this person's also thanking you for such a beautiful and inspiring talk.
Okay. So there are books. There is a book called A Dry Bone to a Living Man. and that was written by a gentleman named John Lewis, who is British. And he basically, it's a biography of Dr. Still. So he came to the United States and basically sat himself down in Kirksville, Missouri, and studied everything he could possibly find about Dr. Still and wrote a beautiful book. It's long. We have some great osteopaths who have websites that I refer my patients to because they are so well done. And I can, give you those names, I guess, to go to their websites. One is Dr. Mark Rosen. Another website is Dr. Eric Dolgin. That's Dolgin. Another great website is, oh my gosh, it's the website in Maine. It's the Osteopathic Health. I don't know. Bonnie, do you remember Dr. Hankinson's website? Oh my gosh, I can't remember it. But I think it's called Maine's Osteopathic Health and Wellness Center or something like that. But a name that you could research is Dr. Donald Hankinson. And that is another beautiful website. And if you go to the website and you look under the tab about osteopathy, you can read through, 3 different views and beautiful writings of bringing together all of the history and kind of what we do in different perspectives. Of course, Dr. Still's books, his autobiography, there's the principles and mechanical principles and philosophy. There's the philosophy of osteopathy. There's research and practice. So he has tons. You can go to the Kirksville Medical School's library online and read tons about Dr. Still and Dr. Sutherland for that matter. Dr. Sutherland's books are Osteopathy in the Cranial Field, the first edition. Teachings in the Science of Osteopathy and Contributions of Thought. He also wrote The Cranial Bull. And there's a website of Dr. Jellis's. It's called CFTO. I don't know that there are a lot of his writings on there, but his daughter, Marnie Jellis Long, takes care of that site. I think he has an audio series, but you have to be an osteopath to purchase those. And then, of course, taking courses.
Thank you. I think, yeah, we were trying to capture all of those.
How are we doing?
I'm so sorry, my dog is barking.
I don't care. I love it.
All right. Well, if that's the end of our questions, yeah, and Bonnie had a comment, Dry Bone to a Living Man is the biography and probably the easiest to read for a layperson. So I am putting that one on my reading list. Maybe some of you all will too. So I just want to thank you again, Christine, so much for sharing with us today. If you have any last words for us, you can share them.
Well, these words came from Dr. Still and then from Dr. Sutherland and then from Dr. Jellis about digging on, in our life, that we keep searching. We are at peace and neutrality, but we keep digging for the answers to come.
All right. Well, thank you again so much. Many thanks for coming in the chat. This has been such a wonderful talk. So we will dig on, and I hope all of you find stillness in this day. Again, thank you so much to Christine, to all of her teachers. Deep gratitude. And again, Christine will be serving at our annual healing immersion in March. That link, maybe we could drop that link in the chat one more time for anybody who's interested, and hope to see you there or on our next Pranada Wellness call. You'll get an email about that in the coming weeks. So thank you everybody for being here today. Bye.